The mHealth study to prevent stroke is a very important innovation. It used modern ecosystem of the internet to screen patients for atrial fibrillation. It started with a very large population of patients belonging to the Aetna health insurance system, about 20 million, and found about 360,000 of them who might be vulnerable for atrial fibrillation and for stroke related to atrial fibrillation. And they then contacted these patients through the internet, through emails and so on and so forth. And eventually they found a population, very small population actually, of about 2,500 patients who wanted to take part in the study. The study was very simple. It was that the patient would wear for 2 weeks an ECG patch electrode, and then they divided the population into one half who got the electrode early, immediately after agreeing, and another half that would be seen and studied 4 months later. And they were able to compare in that first period what the yield of atrial fibrillation was compared with the yield in the patients who didn't have the monitoring. And they found something like just over 5% in the monitored patients and about 0.6% in the patients who were not monitored. So this is about a 9-fold increase in the likelihood of having atrial fibrillation discovered. They then took the patients, all the patients who they'd monitored, and they compared them with a group of very similar patients enrolled from a completely different data set who were not monitored at all. And they then followed these patients. There was far more atrial fibrillation discovered, obviously in the patients who'd gone through this monitoring scheme than the ones who hadn't. But they were looking for outcome events, and the outcome events were not different at all, even though some of the patients from the monitored ECG arm of the study had been started on anticoagulants. But that's not really much of a surprise because they'd only followed them for 8 months. So at the end of the day, the question comes down to, if you find atrial fibrillation and it's a short burden, a low burden, a short duration of atrial fibrillation through continuous monitoring, are you going to start anticoagulants? And the answer is, we don't know. And we are waiting for studies that will tell us whether that's an appropriate thing to do. And they are randomized studies, they're underway, but they're not here yet. But of course there's another opportunity. You can, in these patients who have atrial fibrillation discovered, begin to think about whether you could prevent the progression of atrial fibrillation, whether you could manage them in other ways so that they never develop a risk of needing an anticoagulant and don't have a risk of stroke. Well, at the moment, none of that is done. But it's a very interesting study in the modern internet ecosystem.